My name's Todd, and I'm a physical therapist for BJC Home Care Services. I spent 14 years prior to coming to home care in the outpatient setting. The beginning was in the industrial rehab setting and then in the private practice. I owned a business for probably 10 of those years and just decided to make the transition to something different. Good morning, Sam. How are you doing? The difference between working in the hospital and working in the home care setting, when you get to the patient's home, you just have to worry about that patient. You're not jumping back and forth between patients. You don't have to worry about Mr. Smith on the treadmill and Mrs. Jones on the hot pack and jumping back and forth to multiple patients. A typical day starts out in the morning when calling patients and getting a schedule set up, making times that are convenient for you and your patients. And then you typically see about 5 patients a day, and then you arrive and get the basic vitals, baseline information, how they're doing, and then you get into the nuts and bolts of things with starting them on their exercise program, making sure that things are going well with that, progressing and making changes as necessary. And when you get done with that patient, you're on to the next. You've got to be outgoing. You've got to be a people person because you're dealing with all different kinds of people. Some people are very happy and fun and friendly, and others not so much because they are suffering from an injury, an illness, a surgery, and you've got to have some empathy on those patients as well to work with them. So you've got to kind of walk that fine line of how to get along with each of these patients because you've got to motivate yourself and motivate these patients to their fullest potential.
Very good. 128/8.
With the home care setting, you get a wide variety of patients. You get a lot of orthopedic patients, the total knees, total hips. You do get the cardiac patients, stroke, neuro. So really a wide variety of patients you get to see. We all have laptops. Our laptops have a wireless card, so we can update the latest information on our patients throughout the day, wherever we happen to be in the field. Cell phones, everybody's a phone call away. IS support's a phone call away. Any other team members are just a phone call away. So the technology is great. You're never left out there alone. You always have a lot of resources at your fingertips. There's lots of people that could be involved in a patient's care. You could have a nurse on the case, occupational therapy on the case, a nutritionist could be available, social workers are available, wound care specialists can always be called in. BJC has an endless source of professionals that you can bring in to use on these patients. BJC is one of the biggest groups in the area. I like the stability of being attached to one of the biggest names in the industry. They've got a lot of technology, a lot of support, and it's just a great organization to be a part of.
And that looks good. I'll give you a call and get another appointment set up for later this week.
Seriously consider the home care setting. It's a lot more flexibility from being in the hospital. A very wide variety of patients. You're not going to get stuck into just treating a certain subgroup or anything, and you just have a lot of freedom and flexibility. So I would definitely try to encourage someone to explore their options.